Evidence-based principles are essential in clinical dentistry to ensure the most effective and optimal treatments. This involves using scientific research, clinical expertise, and patient preferences to make informed decisions. By implementing these principles, dentists can provide the best possible care for their patients and improve outcomes. It also helps in avoiding unnecessary procedures and reducing costs. Let's dive in.
Ever wondered how critical are evidence-based principles in clinical dentistry? Let's delve into this fascinating topic. You see, evidence-based principles are the backbone of clinical dentistry. They are the framework that guides decision-making and ensures the most effective and optimal treatments. Now, what makes up these principles, you may ask? Well, it's a trio of key elements: scientific research, clinical expertise, and patient preferences. Each of these components plays a vital role. Scientific research provides the hard facts, the data we can rely on. Clinical expertise, on the other hand, brings in the practical knowledge, the wisdom gained from years of hands-on experience. And let's not forget about patient preferences, which put the individual at the very heart of every decision. By weaving together these threads, dentists can provide top-tier care, improve patient outcomes, and even avoid unnecessary procedures, thereby reducing costs. Indeed, evidence-based dentistry is the cornerstone of effective and optimal dental treatments. Let's delve into a case study that exemplifies the power of evidence-based dentistry. Imagine a patient, we'll call him John, who visited a dentist with persistent toothache. Instead of jumping to conclusions, the dentist practiced evidence-based dentistry. He began by integrating his clinical expertise with the most current, clinically relevant scientific research. In John's case, this involved referencing various studies on toothaches and their common causes. The dentist didn't stop there. He also considered John's personal history, symptoms, and preferences. John's fear of invasive procedures was taken into account, and the dentist sought a solution that would be both effective and less distressing for John. By combining these three pillars, scientific research, clinical expertise, and patient preferences, the dentist was able to diagnose John with a non-critical pulpitis. This is an inflammation of the dental pulp, which can often be managed without invasive procedures. Instead of rushing to a costly root canal that might have been unnecessary and anxiety-inducing for John, the dentist recommended a less invasive treatment. He prescribed a course of medication and a strict oral hygiene regimen. This evidence-based approach not only saved John from an unnecessary procedure, but also significantly reduced the overall cost of treatment. As time went on, John's toothache completely disappeared, demonstrating the effectiveness of the treatment. The dentist's decision, guided by evidence-based dentistry, led to a successful outcome. As seen from the case study, evidence-based dentistry is a game-changer, enabling dentists to provide top-notch care. So, are you ready to take your practice to the next level? It's time to adopt evidence-based practices. Staying informed about current research, honing your critical appraisal skills to evaluate evidence, integrating patient values and preferences, and collaborating with other healthcare professionals are key. These steps not only enhance your practice, but also ensure your patients' well-being. By embracing evidence-based dentistry, you can ensure that your patients receive the best possible care based on the latest scientific evidence. So why wait? Start your evidence-based practice journey today.